although I think Katie does all the work. But I'm a physician over at Children's Mercy Hospital. I do sports medicine over there. I try to help with the sports sector as well, but that happens to come right in the middle of my clinic where these talks are usually on my administrative day, so I get to join in these all the time. But yeah, so just thanks for coming to the meeting, and hopefully we can get everybody involved in some implementation projects and ideas and things to work on. Katie, you want to? I think you probably know everybody, but
yeah, I can go ahead, and after I'll popcorn. So hi, I'm Katie Amy. I'm with the Kansas City Healthy Lifestyle Collaborative. We're a program at Children's Mercy that sits in the Center for Children's Healthy Lifestyles and Nutrition. One of our initiatives is the KCPA plan, and I'm only saying this as background for anybody new. So the healthcare sector is one of the societal sectors in the KCPA plan that I support. So just quickly and briefly, I will go ahead and popcorn over to you, Abby.
Hello, I'm new here to this specific sector. I've attended some of the other ones previously. I'm at the Platte County Health Department. I've been here about 6 months, so I'm still pretty new, still learning everything. I'm glad to be here. Brian, if you want to go.
Yeah, I am Brian Mays. I am the coordinator of school-based health initiatives at Children's Mercy, and I have been to a few of the KCPA meetings, but I'm kind of new to the group here. But certainly this is a program that we promote on our end in the catalog, and just me dealing with schools.
Great.
Thanks for being here, Brian. Hey, Catherine, would you, I don't know if you're, yeah, I don't know if you were able to log on. Seemed like you might have had a problem earlier, but would you want to go ahead and introduce yourself really quick?
Sure, I can do that. Sorry, yes. My Teams didn't want to open, and at first I could hear all you guys, but I couldn't see you, and I don't think you could hear me. But I'm Katie Miner, and I am a local physician who is teaching lifestyle medicine, which includes physical activity as a pillar for UMKC, and I'm going to kind of branch out to the UMKC's PA program this year and help a little bit with KU, but I am trying to get more involved in the medical school curriculum and promoting, anything that would be considered in the lifestyle medicine sphere to teach the students in healthcare going forward. And I just want to serve my time and help out as much as I can.
Awesome. Well, thanks everybody for joining. Yeah, so every other month we do the full healthcare sector group. And then in the months in between, we do the curriculum group, and probably switch over to doing the Just Walk group every other month, but I don't know if that's been officially established yet, but we did a little survey from everybody. But basically, what we're trying to do, as you're all familiar with the KCPA plan, we're just trying to take our strategies that the healthcare sector decided on several years ago and kind of get those implemented and get those working. And the big one with the healthcare sector was they're trying to improve education for healthcare workers in all levels of healthcare workers. And some of that, the big one that we've been trying to do is the curriculum group, but also trying to get healthcare workers, out in the community and showcasing some, do what I say and what I do kind of stuff, which is where the Just Walk program comes in. Used to be Walk with the Doc, but it's a little more broad. So those are kind of our two big initiatives. The other big initiative we had with the group was billing and coding, but that has kind of been put on hold a little bit. Seems like it's a huge barrier kind of all around the country um, to making physical activity part of the real kind of office visits and stuff that you do with the direct patient interaction. So that one's a little trickier, but yeah, so those are the things we're mainly working on. And you can always check out any of the strategies and see if anything, if you have any passion or ideas about any of them that could help. But with public health, with school-based health, I think those are huge pieces. And I definitely, Brian, I'd like to talk to you another time about the school-based health stuff because we tried to get that going several years ago and it kind of slithered and faltered at Children's, but again, we can talk about that later. But yeah, so today, kind of what we're doing is we're mostly give us some updates on the Just Walk and the curriculum groups, and there's a few things that are going to happen in the next couple months that we want people to be as involved in as they want to be. But I think we can start with the Just Walk part, and really, Katie knows more about that than anyone, so I will let you fire away.
Sounds good. So previously at Children's Mercy, we had 2 Just Walk locations, one on the Missouri and one on the Kansas side. Well, participation wasn't that great, so we decided to refocus our Just Walk initiative from the general community to more employee wellness. So we have 2 walks. And I'll elaborate a little more on this. So one is at the not Health Science District. It is the Health Science District. It is the Adele Hall. Oh my goodness, Hospital Hill Park. My apologies. It's at Hospital Hill Park at Adele Hall, and those are on the 4th Thursday of every month. So we do have a walk coming up this month on the 22nd, and then we have a walk at Crown Center, and that one, there's not actually one until June, and those are the 4th Wednesday of every month. Well, I say this, that it was targeted toward employee wellness. So for Children's Mercy employees, they actually get well-being points, but we've decided it doesn't really encompass what our aim was at the beginning, so we're opening it back up to the general public. We are not the only Just Walk location, by the way. So UMKC, they host one. It is the 3rd Saturday of the month at, Jay, I might have you help me out. East Lake. What's the park that Stephanie hosted at? Do you remember? You're on mute.
Sorry, I think it's over towards Swope.
It is.
Right.
I just,
I
it's
think
like,
they go around. Yeah.
yeah.
I haven't been, so I don't know exactly where it's at, but
Like
that one is
East
really
Lakewood
successful.
Center or something. Yeah, that one, they have great attendance. They actually partner with AARP.
Which helps.
Yeah, and so just free advertisement and stuff. But there are other Just Walk locations. But just bringing it to the group that this is kind of our focus now, is that we went from community-based to more employee-focused, and now we're expanding back to the community. So you might hear from us with like flyers to promote these walks in the future. And as Jay mentioned, if you'd like to be a part of the group or learn more about Just Walk, or if you need help starting up your own location, we do meet. Right now it's every second Tuesday of the month, but we will be switching to every other month moving forward. And we haven't figured out a new time. Right now we meet at 8:15 in the morning, but that doesn't seem to work for everybody. So yeah, that's all I have with Just Walk. I don't think we have anybody on here that has their own Just Walk location. So or else I'd ask for updates.
Yeah, there was
From our other folks.
we were trying to do one out by Corporate Woods Business and Industry, but that seems like that is not, no business out there is really taking hold of it and championing it. We're hoping some employee wellness program out there would be a good fit, but it just hasn't materialized. So I don't know. There is a physical therapy place there who is willing to be kind of the healthcare part of it, where they do a little education. The Just Walk things, if you've never been to one, there's like a 5 to 10 minute little health education part from a healthcare worker to begin with, and then there's the basically hour walk. That's kind of the idea behind it. So give a little some quick tips like, hey, eat fruits and vegetables, not Doritos, or something to that effect. a little more in depth than that, but definitely for the lay person. So yeah.
Are
But have you
there
got any ideas?
any Just Walk locations north of the river?
That is a good
Not
question.
that I know
So doing a walk. I'll see really quick. So I just put the link in the chat. So you can look up the different walking chapters within Missouri or Kansas. I mean, obviously not just those states, but let's see. There's Missouri. Yeah, Albany, Casey, Mo, that's University Health. Nope, does not look like it. So to kind of piggyback more off of what Jay was saying, our business and industry sector decided that one of their implementation projects that they would do would be to host another Just Walk location, and they would make it very centered around employee wellness. The problem we're having is that our business and industry sector group is having a difficult time having a organization commit to wanting to be responsible for hosting the walks. So that's where we're at. So we have funding to start another Just Walk location, but we don't want, as the sector group, to be the ones who are doing all of the work. We want the investment from the company themselves. We want them to participate and actively want to be engaged. And that's kind of where we're having the problem. So just a little background on that.
Yeah.
Yeah.
I mean, that's the way to get people there. I mean, that's been our biggest problem is when we tried to promote it as kind of a thing for families and kids, just nobody really showed up. Saturdays when people could do it is also when everybody's off doing sports and family things. So I think that just wasn't a good combination. I think lunchtime around a bunch of businesses kind of makes sense. That was the idea. So we'll see. Maybe someone will decide to do it.
And
Go ahead.
oh no, I was just going to respond verbally. Abby, absolutely, we can talk at 12. Be happy to dive in more to some of the projects we're focused on, and yeah. Okay.
Is it public health sector meeting at 12? Is that
No, actually, I have a separate meeting.
totally different
with,
meeting?
Yeah, Platte
Okay.
County Health Department. So
Gotcha. Okay. I'm gonna move on to the next thing. So basically, the curriculum group. We've been trying to promote the changing of some of the med school curriculums around town to focus on physical activity, and that is sort of morphed into the lifestyle medicine, which Katie can, she's been doing it down on the ground and with the residents and students, but in general. Both KU and UMKC have made some changes in their curriculum over the last couple of years and tried to incorporate a little more of the lifestyle medicine and physical activity in there. We actually just approved an implementation project for UMKC in both the pediatric and family medicine clerkships. So when the med students are doing their like actual hands-on in the hospital rotations or in the clinics rotations, and for the family practice residents. So it's a little education in both arenas, and it's got some modules for students to learn on, and some specific kind of directed hands-on asking patient questions and monitoring patient physical activity, all during the clerkship. So that has been, I think, pretty successful. It's a good place to start. I think the family practice and pediatric and probably internal medicine clerkships are really the place to do that in the outpatient setting. When you're in the hospital super duper sick, probably promoting lifestyle medicine isn't where anyone's really going to pay attention. We're worried about getting out of the hospital, but in that clinic setting, I think is really the place to go for that. So that again has
You'd be
been
surprised, Jim.
well,
You'd be
yeah,
surprised about that.
yeah, yeah. I'm sure in the hospital it would be a good place to talk to them. I guess they're captive for a while, so maybe you can really sit down and really go over it with them. But yeah, so anyway, that's where it's kind of going to start at UMKC. KU, not as clear cut, and then KU or Kansas City University, the DO school in town. They kind of not really been incommunicado about it for the last year, so we don't know exactly how they have progressed some of that. But they had some enthusiasm, year and a half ago when they were still kind of involved a little bit more. So those are the places where we've seen some changes. I think the PA school at UMKC is another place where they're trying to add a little bit in. We'd really like to get nursing schools involved and pharmacy schools and any other schools where there's education going on, teaching, the teachers kind of thing. So yeah, go ahead.
So one thing that I was thinking about, because I was sort of actively searching for some CME modules for more of exercise as medicine, and I think I reached out to you about it, but I did find some modules that they're purchasable, but they're a affordable price for people, but it is exercises medicine for basically just the lay provider, the healthcare provider, the family medicine, internal medicine doc, or practitioner that really heavily relies on the relationship with physical therapy and occupational therapy, as that other, healthcare provider that can team up with the physician or the practitioner in the patient care when it involves exercises medicine and really personalizing it and helping to personalize it for the patient. And I just wonder about, I honestly don't know off the top of my head if we have PT/OT programs that we could reach out to as well, if they would be interested in seeing what they have in their curriculums and even, sharing what either they know or what we know between the schools. And I could say more on that, but I just it was just a thought that I wanted to point out. Didn't know what anybody thought of that as a possibility.
Sorry, I keep muting myself. So yeah, no, I totally agree with you. I think PT/OT is a great place to start. They've got some real knowledge about how to get people moving. The whole idea of the KCPA plan is collaboration and sharing, so that if PT and OT schools have some ideas, then nobody else has to reinvent the wheel. They can just use that idea. So if you have any contacts in any of those schools around the region who want to be involved, let us know, or just tell them to join the meeting. But yeah, I think that's great. And I did look at those things you sent. Yeah, what I didn't look at though was how much it costs, and I don't know, how often that's really a barrier, if it's pretty low cost. But there are for kind of the general healthcare worker. Joey Leitner over at UMKC did create some free modules. I don't know if you got to see those. I meant to send those. In response to your email, but that's at least a free place to start. And it's probably not as in depth as the things you sent me, but yeah, those are nice modules, kind of asynchronous learning. People can do it on their their free time or over lunch or something. So it's kind of nice. So you don't have to show up to a specific day when you got clinic or you got other job obligations. So
I went ahead and posted those in the chat too. So these physical activity modules were actually one of the implementation applications we funded to create, and it was a collaboration with some of the different faculty over at UMKC. And I think University Health. So
Okay, so that one you sent us, you said about $30 for a 2-hour module. Okay, yeah. Yeah, if you know anybody in the PTOT school, that'd be awesome. Yeah, just I'd be happy to chat with them. Katie's got like an official letter that we can send out to send them to join in the group. So yeah. And then I forgot the other thing. We have a lot of speakers coming around lately, I think, for some lifestyle medicine. Really, culinary medicine seems to be the hot topic of the last 6 months. I think, sorry, I'm reading this right. June 10th is when we'll have a pediatric grand rounds speaker on culinary medicine coming. Sabrina Fauquier. She's a physician, but we're trying to see if anybody would be interested in sitting down with her for like a small group kind of roundtable at some point during that visit for a little more, in-depth kind of Q&A session. And we figured this is kind of the group to start with and see if they would be interested. So I figured you would, Katie. So yeah, and I don't know, I don't know what kind of the threshold number is, if we need 10 people there to make it worth it, or 5 people, or what. Maybe that'd be more of a question for Marissa Love. But if anyone is interested or know anyone who would be interested in hearing that and coming and talking, that would be great. I think even something like in the schools, teaching some culinary medicine to families, if some of the schools have space, if there's something that could be done after school, bring some families in. If people don't know how to cook or not cook healthy or anything like that, those would be places where culinary medicine could potentially be really valuable. So to find a way to make that work, but that could be maybe even on our list of school-based health initiative, our menu of options for some of the schools, things like that.
So to kind of add on to what Jay was saying, so in the past we've worked with Dr. Love, she's over at KU, to kind of piggyback off what they've been doing. So they had a guest speaker a few months ago, Dr. Albin, who talked about culinary medicine. So that's really their focus with the lifestyle medicine stuff, is they're more into the culinary medicine portion of it. And so they are bringing another guest speaker who Jay mentioned, and they're actually also presenting at Children's Mercy for an actual grand rounds. So we have the opportunity after they present to sit down with her. And this could be a smaller group, a larger group, but more than anything, it's just seeing who would be interested, because I don't have a lot of information right now, and there's not a lot about it posted on our Grand Rounds website through Children's Mercy. So I just want to get some feels out there before I actually schedule like a room and see like what we can accomplish, because we have the opportunity to like reserve a small room at the Center for Children's Healthy Lifestyles and Nutrition, where like anybody could attend. So anybody from an outside organization can come and sit down with her. So we want to provide that opportunity to everybody in the group. And a little bit about her is posted in the chat, because I'm not too familiar either. It looks like she owns her own like cooking company. So
yeah, she's one of the physician faculty, or at least she was, for the CCMS American College of Culinary Medicine certification program. She's quite dynamic. I mean, she's like a Jackie Albin a little bit. So
she was awesome.
And she also, I think she lives in Southern California, and she does a lot of her clientele are bilingual, so it focuses on that population too. But she's, I think, internal medicine, but focuses heavily on the culinary medicine aspect of her practice.
Thank you for that. That'll help me put together some marketing materials.
Yeah, I think that anybody who goes to the grand rounds will come away, satisfied and will have learned something.
Well, based off that, then I will go ahead and proceed with maybe putting together a smaller group like we did last time. Yeah. Okay.
Yeah, I know I will not be able to attend because we got to do sports physicals that day. So sorry, but
Yeah. Is what it is. I'll handle it.
yeah. um, yeah, so those were kind of the big announcements. I think one other thing that you had put on there, Katie, just the Kansas City Healthy Lifestyles Collaborative quarterly meeting will be June 11th. And I actually think the speaker might be my fellow talking about physical literacy throughout life. That's what Robin and Andrew were chatting about yesterday. So we'll see
Yeah,
if that follows through.
I hope so. Yeah, I was gonna say I don't know who the guest speaker is yet, and I just found out that that may be a potential topic yesterday. So
Yeah, but I just got them emailing each other yesterday, so I don't know. We'll see what happens. But it's a
great.
good talk. I've
yeah.
actually heard the talk before. So
That was my research focus in my undergrad was physical literacy, so I'd be interested.
all right, yeah, you can tell him if he's wrong about some of the stuff he's saying. That'll be helpful. Feel free to critique. And then I think the only other thing is that, yeah, I guess we're switching to all the Outlook stuff away from the whatever Eventbrite or whatever it was that didn't go through on
The
anybody's stuff.
two-step process, yeah.
Yeah. So just totally open for anything anybody wants to discuss and talk about right now. If you got any thoughts or ideas or things that we should do differently or better. Again, I highly encourage anybody who knows anybody who might want to be involved in any of this. We we're we always want more people, more heads, more
Voices
brains
at
in
the
the
table.
room is good.
Yeah, and there's a lot of opportunities for collaborative work. And let me state this because I know, Brian, I haven't seen you in a minute, and I used to support the school sector. So, like our sports sector, we partnered with Aspen Institute and we did a state of play report. And we had a lot of our sector groups come together to put that report in place. And I can go ahead and try and look this up really quick. But really, that report was really informative, not just within the um, sporting programs that were available to youth around the area, but it gave a look inside about like physical education in schools and how youth perceived like their coaches and stuff. So again, it could tie into the school sector or why a lot of youth participated in sports was they just wanted to have fun. I'm terrible at talking and typing, so, but yeah, there's a lot of opportunities for collaborative work, and we're actually working on scheduling a follow-up to our Aspen report release sometime this fall. So if anybody's interested, let us know, or we'll probably just go ahead and send you an invite anyway. Um, and then our next meeting is it June 1st, July 1st. So if you don't have these calendar or these meeting invites on your calendar, let me know. Because there's a way to add them, or I can always send another invite directly. So it'll show up automatically instead of you having to add it to your calendar. So just let me know. I'm working on creating some instructions because I know it's new for everybody, even my team. Okay, this is the state of play report for Casey. Okay. On that note,
So if no one's got anything else, I think we probably can give everybody a few minutes of their day back to do other stuff.
Thank you.
thanks.
Bye.